Hello. Hello. Am I audible? Hello, Dr. Susan. Am I audible? Am I audible?
Yeah, you are audible.
Okay. Okay.
Hello. Yes. Yes, Dr. Richa, you are audible. You are loud and clear. Okay. Yes.
Okay, Dr. Rajan.
रेडी ना?
Start.
उधर से सार बताया ऑडिबल करके बोला सार।
Good morning and welcome you all in national webinar on Hemorrhoids, organized by PG Department of Shalya Tantra, National Institute of Ayurveda Jaipur, on the occasion of 5th Ayurveda Day and World Piles Day. Myself, Dr. Richa Sharma. I am PhD scholar in PG Department of Shalya Tantra at National Institute of Ayurveda Jaipur. As per the tradition of starting any event, we would like to offer prayer to Lord Dhanvantri for his blessings, for which I would like to invite our respected director, sir, NIA, Professor Sanjeev Sharma, sir, our Professor P. Hemanta Kumar, sir, Dean PG Studies and Head PG Department of Shalya Tantra NIA Jaipur for the inauguration. And I also would like to invite our PG scholars, Dr. Priyadeep Raj and Dr. Subhashri for Dhanvantri Vandana.
Okay.
नमामि धन्वन्तरिमादिदेवं सुरासुरेवन्दितपादपद्मं लोके चरारुक्पेन्द्रत्युनाशं दातारविशं विविधोषधीनां जप्यो वदात् निवार
Thank you, Director Sir. Thank you, Head Sir. Thank you, Dr. Suman Sharma Ma'am. Thank you, Dr. Priyadeep and Dr. Subhashri. Now to present opening note, I would like to invite respected Professor P. Hemanta Kumar Sir, Dean PG Studies, Head PG Department of Shalya Tantra, NIA Jaipur, for the welcome speech. Over to you, sir.
Om Dhanvantiraaya Namaha. Om Manjunadaya Namaha. Respected Honorable Director, Professor Sanjeev Sharma ji, and, and respected Madam Suman Sharma ji, Associate Professor in the Department of Shalya Tantra, and today's speakers, guest speakers, renowned personality in the field of Ayurveda and modern, and respected Ravi Shankar Parvaji sir, and respected Malpani sir, and Parvaji sir, from he is the senior surgeon, proctologist, Guru, Rashtriya Ayurveda Vidyapit, and he is the founder and he is the pioneer to start Kshara Karma preparation, application of Kshara Karma in various anorectal diseases. And I welcome this webinar on Arshas, hemorrhoids, especially on the occasion of 5th Ayurveda Day and World Piles Day in November 20th. And I welcome Dr. Malpani sir. He is the senior surgeon, laparoscopic surgeon, proctologist, gastroenterologist, and is a wonderful surgeon and is ex-HOD of SMS Medical College in Jaipur. I heartily welcome this webinar on the occasion of World Piles Day. And I welcome all my team, Dr. Narendra ji, Dr. Ashok ji, Dr. Swapna, Dr. Manorama ji, and all my PG scholars and PhD scholars, and all the deans of our National Institute of Ayurveda, and all HODs, professors, associate professors, assistant professors, lecturers, teaching and non-teaching staff, and I wholeheartedly welcome this program, especially the senior teachers in the field of Ayurveda and the senior practitioners and medical officers, alumni of NIA, and all faculty, all the fraternity of Ayurveda, and wholeheartedly welcome this program on national webinar on Arshas. And once again I welcome all the members to involve this program, and you interact the speakers of today's session. And last 10 years we are conducting this World Piles Day program in November 20. Usually we are conducting previously in offline. Regularly there is a medical camp for piles patient for awareness of the piles regarding the Ayurvedic management. And also we are conducting CME programs for Arshas and hemorrhoids. And this time first, because of COVID condition, we are organizing national webinar through virtual platform. And I think more than 5,000 delegates registered throughout India and also abroad. And I really proud to say that. And regularly we are performing yearly more than 1,000 surgical procedures, including Arshas, and especially for the treatment of Kshara Karma, that is called caustic cautery, and Kshara Sutra, that is the medicated ceton we are using in the hemorrhoids patients. And especially we are advising so many patients to prevent the hemorrhoids also with the help of our Patya and Apatya, do's and do nots. And also we can treat in early stages without surgery by our Ayurvedic medicines only. We are treating hemorrhoids patient, and especially Susruta's views of Beshaj Chikitsa medical management, and Kshara Chikitsa, Kshara Karma, that is called caustic cautery, and Agni Karma, that is thermal cautery, and another is called Sastra Karma, that is called surgical procedure. See, some of the conditions we are going for the Ayurvedic surgical procedure, in especially for the prolapsed hemorrhoids and thrombosed hemorrhoids, we are going for Sastra Karma also. And once again, welcome this webinar for all. Namaskar.
Thank you so much, sir, for giving all of us a warm welcome on this occasion of 5th Ayurveda Day and World Piles Day. Now, proceeding forward, I would like to invite respected Professor Sanjeev Sharma, sir, Director NIA Jaipur, for the inaugural speech. Over to you, sir.
Thank you, Dr. Richa, and very good morning to all. Our respected Professor P. Hemant Kumarji, Head of the Department and Dean PG Studies, National Institute of Ayurveda, deemed to be University. Our faculty friends, Dr. Ashokji, Dr. Narendraji, Dr. Sumanji, Dr. Swapnaji, Dr. Manormaji, our guest speakers, Dr. Ravi Shankarji, Dr. Malpani ji, all my dear PhD scholars, PG students, and all the participants who are viewing this whole program through Facebook or YouTube channel of NIA. First of all, on the behalf of National Institute of Ayurveda, deemed to be University, I extend a warm welcome to all of you on this virtual platform. And I am happy to share with you that now our Honorable Prime Minister on 13th of this month, that is 13th of November, a National Institute of Ayurveda was dedicated to the nation by our Honorable Prime Minister as deemed to be university. So this is very important information and big achievement for we people. And I really want to thank all my fellow colleagues and my students and all who have helped us to pass through this journey to get the status of deemed to be university. Friends, today the Department of Shalya Tantra is organizing one-day seminar on or webinar on Arshas or piles or hemorrhoids to commemorate and to celebrate the World's Piles Day. Friends, the piles or hemorrhoids or anorectal disorders are very important disorders, very much prominent in the society. And I feel that approximately 70% of population, they face some kind of anorectal diseases at some point of time in their life. So the prevalence and prominence of the anorectal diseases is quite high, but at the same time, these are neglected on the part of patient, because due to hesitancy and privacy, patient first of all hides each and everything regarding this disease. He tries to find out some homemade solutions, remedies, or sometimes he falls in the hands of the quacks. And ultimately, when he does not get any cure, then he seeks the expert help or expert advice. Till then, she is too late, and the problem that becomes manifold. Second thing, this area is also, I can say, is neglected on the part of surgeons, because whenever I find the operation theater list of busy hospitals, busy operation theaters in general surgery area, these patients are posted in the last of the list and usually are postponed, or these are managed by inexperienced unexperienced residents or some other kind of doctors. It means the due respect, due regard, and due treatment and due care which these patients deserve, that is not given. And there are many facts and problems in this regard. So this disease is the burden of disease in such diseases is continuously increasing day by day. Here, when I am saying Arshas or hemorrhoids, we should not restrict only up to the hemorrhoids. We should take the anorectal disorders as a group under this category. And this day marks the day for awareness of this area. That awareness should be there amongst the medical fraternity, and at the same time, the awareness must be there in the society. So at both the ends, the awareness is lacking. If we want to really celebrate this day and want to really solve the problem or to control or contain the problem, we have to carry the message to the masses, to the society, for that how they can prevent these diseases, and if such disease occurs, then what measure they should take, what protocol or what routine they should follow to get the proper treatment. Because society, although today we are organizing this seminar, and at so many sites this webinar will be organized, but this is being organized for the medical fraternity only. Of course, that is also very much useful, and definitely that will spread a wide message to amongst the medical professionals. But at the same time, such kinds of activities are we should go into the society for the mass awareness program, and we should design some certain such programs and such ideas. We should come out with such ideas that the awareness among the masses or societies and should be there, and a campaign should be installed so that awareness in the masses, in the society should be there, and so that we can reduce the burden of such kind of diseases. And the patient needs education, he needs counseling, and ultimately he may need some kind of treatment, some kind of intervention, medical intervention or surgical intervention. So my message to all the particularly Shalya Tantra fraternity of whole of the country, not only to NIE Jaipur, but the whole of the country, because eminent personalities are there and our students are there. So can we launch a campaign for the awareness of society or our population? Is it possible? And if it is possible, what should be the mode? And NIA can take the lead for this kind of campaign. So we can have a plan accordingly, and we can launch that kind of campaign. Second thing, that nowadays we know that this is a COVID-19 era, and during this COVID-19 era, so many changes has happened, and one of the important learnings is how we can connect with each other on virtual platforms. And this is the outcome, as today we are joining each other with and we are able to interact with each other on this virtual platform, and this is really new learning for we people, and this is at the same time very much useful also, although there are certain drawbacks, but very much useful that being at our own place we can connect with each other, and we can spread the message, and we can deliberate the things very nicely. That is true. But so far as anorectal disorders are concerned, or even other surgical disorders are concerned, what we have seen that during this COVID era, these diseases have further been ignored. You will agree that so many hospitals, even including our hospitals, were closed for months together due to lockdown, and patients who is already hesitant to discuss about his anorectal problem, now he find a big barrier that how he can reach up to the doctor to discuss his problem. And then when he reaches up to the doctor, we examine the patient with physical distancing. Only we are prescribing the drugs with the history. Just after taking the history, we are not properly examining the patient, and then we are not properly treating the patient as well. Because without exact examination, we cannot understand. So my appeal to my department, my Shalya Tantra department, although they are taking good steps, that how we can attend such kind of patients during this critical period, because so many diseases are being ignored by the patient due to fear of COVID or due to unavailability of the beds in busy hospitals. But being Ayurvedic surgeons, we can help a lot to the patients, and we should design such a protocol, taking all kinds of precautions. We should try to help, and we should try to intervene for the patients. We can go for surgical intervention also by taking all kinds of preparation, and if some kind of help required on our side, on administration side, we can provide. But such patients, the diseases of these patients, they should not be ignored, and on the part of the patient, or those should not be ignored on the part of the doctors or on the part of the hospital. They should be attended properly, because that is the only thing. Although COVID is there and it is likely to stay for months together, what we can predict. So we have to chalk out a definitive protocol that how we can proceed to help these patients. We should not ignore the problem of these patients. This is my these are two just my messages. That one thing is that we should launch a campaign for the awareness of society regarding the anorectal diseases. Then only we can justify the celebration of World Piles Day. And second thing, that during this critical period, please help our patients and don't keep distance from them. Let us try to help them to if they require some kind of surgery or some kind of Sharsutra intervention, please do that with following all kinds of necessary protocols. Necessary guidelines already are there, so we should do like that. I congratulate the department of Shalya Tantra, the head of the department, Professor P. Hemant Kumar, who is very enthusiastic and who takes everything as what I can say as a challenge, and he manages the things nicely. And so this World's Pile Day is also celebrating very nicely. I congratulate for this celebration, and at the same time, my best wishes for the best webinar today. And I hope that our experts, what they will be deliberating with on the platform, those deliberations will be very fruitful. We will learn a lot from their experience, from their knowledge. And I must appeal to the student that they should be interactive, and there must be some question answers, and doubts must be cleared, and a wide message should be spread to all those who are attending this webinar. With these words, I again congratulate and thank you all, and my best wishes and greetings and happy Deepavali to all of you.
Thank you so much, sir, for your motivational words. It is always mesmerizing to hear you, sir. Before starting our today's topic, we would like to show you a brief presentation of our Shalya Tantra department at NIA Jaipur, for which I would like to invite our PhD scholar, Dr. Durga Katarmal.
Season new.
Good morning to all respected.
Yes. Okay. Let's start. Let's cover presentation. Now start.
Good morning to all respected teachers and delegates. Myself, Dr. Durga Katarmal, PhD scholar, PG Department of Shalya Tantra, NIA Jaipur. Today I'll be sharing few details regarding how the work culture in the Shalya Tantra Shalya Tantra department of NIA is having right now. So what facilities we have is we have a separate OPD for anorectal diseases, and for the general surgery department
Share, PowerPoint share. We say PowerPoint share.
and another OPD for orthopedics, including the Asti Sandhi Rog, Aghat and Marma Chikitsa. And these are the few instruments and procedures we perform on the clinical trial basis. So we have uroflowmetry machine and pressure algometry and flexibar thermal cautery and therapeutic USG machine. Plantar iontophoresis procedures are also dealt with. And this is the parasurgical unit where we do Rakta Moksha, Agni Karma and other procedures. This is the IPD of Shalya department. This is OT where we have the facilities needed, and these are the students performing under the guidance of our respected HOD sir. Here we have the logo of hand-to-hand training, and we try to teach or give chance to all of the students. And these are the surgeries being performed. These are glimpses of few major surgeries done in the NIA OT, including cholecystectomy, appendixectomy, and management of hernias, gangrene, ovarian cyst, hernioplasty, etc. And these are the orthopedic conditions we are dealing, that open reduction, internal fixation, Achilles tendon repair, and above knee amputation, etc. are done. These are few plastic surgeries we have done. And these are the proctological procedures, including hemorrhoids, fissure, fistula, abscess. These are few minor surgical procedures like lumpectomy, lipoma excision, polydactyly, scrotal cyst excision, hydrocele version of sac, and circumcision procedures. These are parasurgical procedures like Shar Karma, Rakta Moksha, Agni Karma, and we have started the work on Marma Chikitsa, and regularly we are conducting clinical trials in the PG and PhD level, and we are getting encouraging results. So we soon be opening a unit, might be separately allotted for Marma Chikitsa. And this was the endoscopy unit started, and it's working very nicely, conducting the sigmoidoscopy, colonoscopy, gastroscopic procedures. And very soon we'll be starting the laparoscopic procedures also in the NIA. And these are the statistical data of previous years, which are increasing day by day, showing the enthusiasm of the entire team of NIA. These are our honorable director, sir, under the guidance of which we are developing and growing day by day, and with the under the supervision of Dr. P. Hemanta Kumar, sir. And this is our respected teachers, Suman madam, Swapna ma'am, Manorama ma'am, respected Ashok sir, Narendra sir. These are visiting surgeon, Dr. Swaraj Meherwal sir, and visiting anesthetist, Dr. Rajesh Arora sir. And these are non-teaching staff. And this is the team of Shalya students. So, and we here promote the concept of hand-to-hand training under the guidance of our respected HOD sir. And very soon we'll be starting a modular OT, which is under construction right now. So NIA is one of the institution where in India's first OT will be modular OT will be available. So with this, I congratulate the entire team and I welcome Dr. Richa Boss again to take on the session. Thank you.
Yes.
Thank you, Dr. Durga, for presenting our Shalya Tantra department of NIA. Now, without taking too much time, we proceed forward with our first eminent speaker, Dr. Ravi Shankar Parvaze, sir. Sir is designated as consultant surgeon at Shushrut Ayurveda Hospital, Puttur. Sir did his BMS in 1985 from Udupi Ayurveda College and MS Ayurveda in 1989 from Banaras Hindu University, Varanasi. Sir is first surgeon who started utilizing Pratisharnya Shar and Agni Karma, not only in piles, fistulae nano, fishery nano, but also in rectal prolapse, pilonidal sinus, carcinoma in situ, etc. Sir worked as visiting faculty at SDM College of Ayurveda from 2001 to 2004. Sir has organized many medical health camps, conducting lots of workshops, published many research articles on Shar Karma and Agni Karma on hemorrhoids. Till now, Sir has cured more than 8,000 cases of piles of by Shar Karma and Agni Karma, due to which Sir is recognized as Chikitsa Guru in Rashtriya Ayurved Vidyapit, New Delhi in 2016. So I would like to invite Dr. Ravi Shankar Parvaze, sir, to enlighten us with his knowledge on the topic Ayurvedic treatment modalities of Arsha. Over to you, sir.
Thank you very much. May I proceed with my presentation?
Yes, sir. You
Am I
can
audible?
present your side, sir. No problem.
Okay.
You can try your side. If it is not possible, then we will go for our presentation.
Share. Share with me. Okay. Share with me. Am I audible now? Hello? Am I audible?
Yes, sir. Yes, sir.
Okay.
You are audible, sir.
Ah, okay. So first of all, let us memorize our Guru. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Let us pray with our all Purva Gurus, Purva Vidyas and Apurva Vidyas. And with this, with their blessings, I will start my presentation. Sushruta's technique of Kshara Karma and Agni Karma in Arshas. Today is World Piles Day, and before that, I will congratulate NIA Jaipur and directors and authorities for getting deemed university status recently. So with this uh, message and I will start my presentation. So directly I go to the topic. So introducing the Arshas. Everyone know Arshas is a very debilitating disease. It is one of the Ashta Mahagadas of, as Sushruta told. As I go on explaining, I will know why it is a, you will know why it is a Mahagada. So the treatment for Arshas told in Sushruta is 4 types of sadhana upayaha, Beshaja, Kshara, Agni and Shastra. And for each this indication, there is a specific indications are there in Sushruta. So for Beshaja, the indication is Attira Kala Jatan, a recently originated Alpa Dosha Linga Upadrava. Such Arshas should be treated with the Beshaja. Whenever a disease can be treated with the Beshaja, we should not go for parasurgical or surgical procedures. Always we should treat with the Beshaja, Chikitsa. If patient gets satisfied, if patient get cured, it is better. Then only we should go for other procedures. So, Shastra Karma is indicated when Tanu Mulani Uchratani Kledavanti, a narrow based projectile moistures, a big Arshas, we should go for Shastra Karma. So another thing is, whenever Shastra Karma is indicated, Ashtanga Sangraha says, Chhatrakarana Urdhva Vistritani Kshara Sutrena. If Arshas is just like Chhatrakara, very big and narrow pedicle, then either you go for Shastra Karma or you can go for Kshara Sutrena Badva. By Kshara Sutra binding also, you can do remove the Arshas. This is what told with the Ashtanga Sangraha. Chikisasthan. Kshara Sutra is Kshara Lipta Sutrena Badhyeti. These two things, whenever there is a very big Arshas. So, what Sushruta and Vagbhata says, whenever it is possible with the medicine, you should go with the medicine only. If not, you should go for parasurgical, Kshara or Agni Karma. If Arshas is very big, going for later stage, a 4th stage, then only you should go for Shastra Chikitsa or Kshara Sutra Chikitsa, because so each treatment is more difficult to the patient. Medicine is easy, difficult then medicine is Kshara Karma and Agni Karma. And Shastra and Kshara Sutra ligation is more difficult. So patient will have more painful experience when they are getting out of the disease. So what is the easiest procedure and permanent procedure, we should go for that. So whenever a disease can be treated with the medicine or parasurgery, then surgery. These 3 things, 3 ladders, which one is better, that you should do. So whenever it is possible with medicine, you should not do Kshara. Whenever it is possible with the Kshara, you should not do Kshara Sutra ligation or excision. So whenever ligation and excision is needed or Kshara Sutra ligation is needed, you should do that, not this Kshara or medicine. So which is the proper indication, that procedure you should do. This is what Sushruta's indication. When the Kshara Karma is indicated, when Mrudu Prasrita Avagana Uchcharitani Ksharena, a soft, extensive situated, deeply situated projectile. You see the difference between soft extent situated and a narrow pedicle with the Chhatraghana Udra Vistritani. And there is a Kleda will be there. You see, Kshara Karma is indicate a Pittaja Arshas or Raktaja Arshas whenever there is a bleeding, and a deeply situated and projectile one. So one is projectile, another one is narrow pedicle with the very big Arshas. And with the mucus secretion, a Pittaja Arshas converted into Kapha, mucus start to come. Then you should go for, and a patient feels heaviness, then you should go for Shastra Karma or ligation of Kshara Sutra. When Mrudu Prasrita Avagada, then you should go for Kshara. If you do ligation in this Avagada and Prasrita, extensively situated, what happens? Big area of tissue is damaged. That is why he says you do with the Kshara Karma. When the narrow pedicle is there, the damaged tissue area will be less. Then you can go for ligation or the Kshara Sutra or excision. So that different aspect he has said. So this is for Kshara Karma, a projectile one, Mrudu, Prasud, Avagata, and bleeding. This is for Kshara Karma. Agni Karma is whenever Karkasha Sthira Prutu Kachinani, a hard one, Kathina, then you should go for Agni Karma. In this condition, if you do Kshara, then there will be more pain will be there. Anyhow, we can do with the difficulty with the Kshara, but the condition whenever Vata Kafaja is there, you should go for a Ruksha is there, you should go for Agni Karma. So definite indication for each procedure is there. This is Kathina and Karkasha. I have handled with the Elise forceps. This should go for Agni Karma. So Agni Karma you can do with the cautery machine or any other instruments. Recently, a thermocautery, any instrument you can use. So materials used for Kshara Karma is Ekachidrarshayantra, Dvichadrarshayantra, Shalaka, Amla Dravyas. Lemon juice you can use, vinegar you can use, anything, any Amla Dravya. Swastika cautery machine for Agni Karma, or you can use Shalaka also. Made it red hot and Panchaloha Shalaka, and you can do the procedure. And Pratisaraniya Tikshna Apamarga Kshara and Taila. This Pratisaraniya Apamarga Kshara, it is not available in market. We should prepare ourselves. Today I am not showing you how to prepare the Kshara. I will show the procedures. Especially, I think everyone of you may be knowing how to prepare the Kshara, or you can refer the textbook. There are Ksharas are three types: Mrudu, Madhyam, and Tikshna. A Tikshna and Madhyama Kshara is for Pratisaraniya purpose. A Mrudu Kshara is always for Paniya purpose, as a medication we can use. So, this is the Kshara. In the Kshara, you see there is a layer of Kshara Jala should be there. Whenever this Kshara Jala is dried up, it loses its potency. So, if it is dried up, to make it potent, you can add Kshara Jala and make it potent. Always it should be semi-solid, or a layer of Kshara Jala should be there, or Kshara. So, procedure of Kshara Karma, I will stress today only on the procedure. The thought and vision, elevated Guda, lighting of the Goda, that should be lighting. In the era of Sushruta, they used to do the procedure at early morning at the time of sunrise. So then the horizontal light will go into the anal canal. That's what they used to do. Anesthesia given. At that time, Madhya was being used. So, and hand and leg are tied tightly, and Madhya used to given to the patient. Then the procedure was being done just 200 years back. At present, we can't expect to do this procedure with the Madhya. We should use a dehydrated Madhya, that is ether. Now, still advancement in technology has happened. We get nitrous oxide, halothane, isoxane. Advanced anesthetic agents are there. We should use it. Anyhow, without anesthesia, we can't, or you can do local anesthesia also. In Madhya, you get Mada Murcha Sannyasa. Sannyasa Avastha, you are doing the Nasya. So, Madhyaja Mada Murcha Sannyasa. Now, with the anesthetic drug, you are getting same Mada Murcha Sannyasa, you are doing the procedure. In the, or you can do the local anesthesia. By that region anesthesia, there will be Kapha Avarana will be there, Supti. You get the sensation is lost, you are doing the procedure. As time goes on, Amapachanakas, you regain the consciousness, regain the sensation in that area. So without anesthesia, this is a very important thing. We are recently World Anesthesia Day happened. Without anesthesia, in front of patient, we all surgeons are big zeros. Behind us surgeons, these zeros, if one anesthetist is there, we will get the value. Zero will get value when there is a one behind us. So if anesthetist is there, then we will have, all the surgeons will have value in the society. We are getting value today. The surgeons are getting value today because of anesthesia. So we can't deny it. Now the procedure, Just you do the forefinger dilatation, or you can do the sphincterotomy at the end also. Anything you can do. By this small work, post-operative pain is considerably reduced. This is the advantage. So you can do this sphincterotomy also. Anything you can do. Then Gృతాభ్యక్తం Gudaya. So you put the proctoscope, cut proctoscope, or ekachidra arshayantra, one side there will be opening will be there. Put the proctoscope. Now we are doing Xylocaine Abhyakta. Then you see the private stage Arsho Viksha. You have to see the Arshas and plan the procedure. What procedure, how we should be done, all these things. You see this patient, you can see the Arshas inside. Yeah. Chalakayo Utpidya. You see, clean the area. What you have to do is backside area you should cover. Then you bring in the shalaka, you bring the pile, all the pile mass into the proctoscopic canal through the cut area. The ekachidra should be brought into, and backside should be covered. Dvichidra arshayantra is converted into ekachidra arshayantra, one side, for the purpose of karma. Pichuvastra yantrayana pramridya. Then with the pichuvastra, it should be cleansed. Should be cleansed. All Xylocaine or Gruta, whatever you use, it should be cleansed properly, so that when you apply the kshara, it will burn the Arshas clean, correctly. Ksharam patayit. Then kshara patana should be done. You see, kshara patana. Kshara should be applied. So how much this kshara should be applied? What is the dosage of kshara? This question arises. What Dallana says, Nakha Uchcheda. How much Nakha is there, that much thickness you should apply the kshara. Then Patavita Panina Intradvaram Pidhaya. Vakshata Matram Upeksheta. Then the proctoscopic canal should be closed. Then wait for Shatamatra. Why you are closing? Either this kshara is a adsorbable material, humidity of the environment may reduce the action of the kshara, or environmental temperature may disturb the pachana of Arshas by kshara, can be disturbed. That is why we are thinking, that is why he told to close the yantra dwara. Wait for Shatamatra kala. It is approximately one Shatamatra kala means once you close and open the eyes, you count 100, it may become about 35 to 40 seconds. That much time you should wait. Then it should be washed with Amla Dravya, Dadhimastu, Shukta. Shukta is vinegar or Phalamla, anything you can use, and you should clean it. You see, now it became burnt. It should be cleansed. So if you wait for more than Shatamatrakal, what happens? The piles may be burnt inside, and Mamsa Dalana can happen. That should be, once you applied, means should be applied only for Shatamatrakal. So if you wait for more time, that may be Mamsa Dalana can occur. That you should not do more time. If you can, if you want to, if it's not burnt completely, again you can apply. Don't apply more than Shatamatrakala. The Pakwa Jambu Varna is Pakwa Jambu Bala Sarvam Ksharam Samyak Dagma Pakwa Jambu Varna. See, it's a very beautiful simile given by Sushruta. See, a red cherry fruit like Arshas converted into jamun fruit in Shatamatra Kala by white kshar. this is really a wonderful thing happens. Then you can judge the whole pile mass is burnt or not. If it is not burned completely, again you can do the procedure. A beautiful simile given by Sushruta. Okay. So write this. If there is a multiple Arshas is there, one Arshas now finished. If multiple Arshas, after 1 week, another Arshas, after 1 week, another Arshas should be done. At the time of Sushruta, he used to do like that only because of non-availability of potent analgesics. Now, with the help of potent analgesics and anesthetic agent, we are doing all the procedure in a single sitting. Or if a beginner of a Shalya Tantra, I think you can do one piles at a time. Once he gets trained properly, hand train has happened, you can do all the Arshas simultaneous. You see, second Arshas at 7 o'clock, we will do the Kshara Karma. Same procedure, clean it, apply the Kshara, wait for Shatamatra, calm. This is what procedure repeats. Okay, this is at 3 o'clock, again doing the same procedure, applying the Kshara, wait for Shatamatra calm. So here I am showing you in single sitting we are doing all the procedures. Now all the Arshas are being dealt with the Kshara. Okay, then Ksharam, then what happens once you finished all the things, if Ksharam Chavekshi Punarapet or Savashesham Punah Dahet. So what means that if once you apply the Kshara to a Arshas, if it is not burned completely, if it is not become complete burnt means it should become Pakwa Jambu Phala Varna. Has not happened. Then what you have to do? Again you have to apply the Kshara for Shatamatra Kal. This is what I think Sushruta is very particular. Don't apply the Kshara more than that time. What he says, once you apply, wait for Shatamatra Kala. If it is not burnt completely, you can apply again for Shatamatra. Not if it is not burnt completely, waiting for 5 minutes applying the Kshara and waiting. No, you should not do like that. So that he says there may be Kshara, Mamsa Dalan can happen. So now it is all the, this one is finished. Yeah. Yeah. Now you see the internal, now we are saying internal, external files, this is internal part and this is external part. At the time of Sushruta, the classification was Ruksharshas and Sravyarshas and Vataja, Pittaja, Kafaja and Raktaja, Sannipataja, like that Arshas classification was there. There was no classification as internal or external Arshas. So now we are doing such classification. Then he used to tell, according to Avastha, if a patient comes with the Sravi Avastha, that is Sravi Arshas. The area where is a Ruksha is a Ruksha Arshas. A same person can have Sravi, at the same time he can have Ruksha. This is Pitta Raktajarshas, this is Vata Kafajarshas, Katina Karkasha Sthira. This should be dealt with the Kshara. What about this one? It should be dealt with the Agni. That is why we are doing the procedure for this Kshara, this Agni. Simultaneously we can do, or we can wait all completely removal of the Arshas by Kshara internal area, that is the Pitta Arshas removed. Then patient may come after for second sitting. You can do the external mass or Vata Kafaja Arshas by Agni Karma. Or if you experience hand with the potent analysis, you can do in a single sitting also. So this is the procedure has finished. Now the external area we are doing by Agni Karma. So Agni Karma is simple, just burning the tissue. You may think I am cutting it. Actually, it is a Pratisaranya type of Agni Karma. Agni Karma is 4 types: Bindu, Vileka, Tresra and Pratisaranya. This is Pratisaranya type of Agni Karma. You are burning whole tissues. So, yeah. See? You can use that cautery machine also. Thermocautery also you can use. or other cautery machines also you can use to burn the Vataka Fajar or Ruksha Arshas. Now we are saying external piles. If bleeding is there, can be stopped. Pain, post-operative pain slightly, or you can use a laser also. You can use anything. Only thing is it should be removed. Other, if you don't remove this one, keep it like that, there is a chances of perianal edema, infection. There will be severe pain post-operatively. Then you are doing the sphincterotomy. You can do posterior sphincterotomy or lateral sphincterotomy. Lateral sphincterotomy is better, I think so. So here I am showing a posterior sphincterotomy. Anyhow, with the Agni Karma only we can do it. We are doing it. So post-operative pain is considerably less by this small, because the only internal, outermost part of internal sphincter is removed. Then pack should be done with the oil, Madhura Ganavashadi, Taila. So then the patient, Estu Madhika Mishrena Nirvapya, then patient sent to the ward. Now, very important part is Paschat Karma. Pack should be removed. That pack we are doing so that perianal edema, development perianal edema can be avoided for about 2 to 3 hours, then it should be removed. Then Madhura Ganavashe Thaila Basti. This is a type of Runa Basti, about 5 ml put and give sits bath. Ushnoda Kavaga Sweda, a Pitta Samsargajavata, you need Avaga Sweda, Drava Sweda should be done. So then mild laxatives, Gandha Kranti Bali, it's a Runa Chikissa afterwards, and modern analysis and antibiotics if necessary should be given. Immunocompromised patients, always it is better to give antibiotics, otherwise antibiotics may not be needed, but analysis is needed. So post-operative complication, this is very important. Bleeding, there may be primary bleeding and reactionary bleeding, primary and secondary bleeding. Reaction, then itself you can ligate it if bleeding point is ligated. Usually it occurs with the Agni Karma. In Kshara Karma, the chances of bleeding is very less. And the night there may be a primary bleeding may be there. If a bleeder is there, arterial bleeding, that has to be ligated. Or second bleeding after 12th day due to infection by corrosion of the arteries, it may happen. Bring the patient to OT and see the bleeding point has to be ligated. That is only way. So chances are there. As a surgeon, always we should think of bleeding. So that has to be ligated. Pain is a subjective symptom. So some patients will have severe pain, some patient will not have pain at all. They go to office next day itself. This is all subjective. Give the analytics and other medicines. Discharge, there will be blackish brown discharge for 4 to 5 days. That is sloughing out of the hemorrhoids. Then it will start to heal. Stricture formation, it should not happen. If it happens, it is the fault of the surgeon. That is why my advice to all beginners is you do procedure one piles at a time, as Sushruta told. Then second piles after a week, third one after a week, like that you can do. But once you get the hand is trained, you can do all the piles at a time. Usually stricture will not happen at all if you do procedure properly. Recurrence is if a patient takes same apatya, there is chance of recurrence, but primary area where we do the Ksharakam, that area patient will not get piles at all, but secondary piles patient may get because of his apatya. Because first of all he got the piles, that is why there is a chance of secondary piles also. That chance is there. So that should be explained to the patient before doing the procedure itself. Otherwise, patient may think that there is a recurrence because you have not done proper treatment. Then it should be patient should be explained already. So then Mahan teacher Mahachikwa Dahit. Then Brashta Buddha Arshas. You see what he said. Sushruta says when Arshas is Brashta outside, Arshas is there without Vina Yantrena Karakarma Krutva. This is what he said. You see, Yantrad Vina. You should do the Nirgathani Tatyartham Doshapurnani Yantrad Vina Svedabhyanga. Then you have to do the Ksharakarma, Brashta Budasya. I am showing you one pile mass. Here you see, this is not third degree piles. It's actually thrombosed internal piles. Actually, it is a brushed Buddha Arshas. So here we can easily deal with the Kshara Karma as usual. Only thing is, without yantra, you can do. That proctoscope is not needed at all. You can do it. This is not a third degree proctoscope. Sorry, third degree Arshas. This is a Mrudu Prasruta Avaghadan itself, but it is thrombosed. That is why Arshas came out. You can do the procedure here. See, just first clean it. All the areas should be cleansed with a normal saline. Then apply the Kshara as usual. Just to apply the Kshara. See, in between Arshas, this area you should not apply. The Kshara is not applied here in between. This is very important. Should not apply in between also. That healthy tissue should not apply the Kshara. Only unhealthy tissue should be selected and applied with the Kshara. A simple procedure. You may think it's very painful. Actually, it's absolutely painless. That patient was absolutely all right from next day itself. So usually we do. But same thing we can't do in a third degree or a fourth degree pulse. That is a Mahanticha. This one, big piles with the narrow pedicle. It is not like that. A Mrudu Prasrat Avaghada. Then you should do the Kshara Karma. But Chhatram Urdu Vistritani, but narrow pedicle is then go for ligation. There is no narrow pedicle in this one. This is a broad Mrudu Prasrat. Then you should do the Kshara. Now you see, it will become very beautiful. Pakka Jambu Phalavarna, very nicely. I hope you can appreciate the thing. Pakka Jambu Phalavarna. So all thing will be sloughed out. Then the external part, or Ruksha part, should be done with the Agni Karma. Okay. Yeah. Very nicely done. So slight area is there. Again, you apply the Kshara. Wait for Shatamatra. Once applied, you should apply only for Shatamatra Kala. You may think this is a fourth degree piles. It is not fourth degree. It is a second degree, second or third degree. Mrudu Prasruta Avaghada Arshas. Actually, according to Sushruta's explanation, it is very scientific. Instead of third degree, fourth degree thinking, you should think this is a Mrudu Prasruta Avaghada or Tanumula and Uchrita. That explanation of Sushruta is very scientific. If for Tanumula Uchrita, go for Kshara Sutra ligation. If it is Mrudu Prasruta Avagada, go for Kshara. I hope you got it. This is after 1 week, patient was completely cured. Just 1 week. Okay. So discussion how this Kshara Karma works. See, it's very beautiful. This one. Actually, this is slide of writing. I think it's Dr. Hemant students' slide. A red cherry fruit like Arshas, after applying white Kshara, it becomes jamun fruit within a minute. How it happens? Arshas means it has full of hemorrhoidal veins with full of blood. When the Kshara is applied, one, it cauterizes the pile mass. Second one is it coagulates proteins in the hemorrhoidal plexus. Protein means it contains hemoglobin. All globins are proteins. They are coagulated each other. That is separated by heme. That then there will be decrease in size. That heme gives you Pakko Jambu Phala Varna. Decrease in size, necrosis of tissue with the obliteration of hemorrhoidal vein radicals, so that necro tissue stuffs out as a brownish black discharge of 3 to 4 days. Then fibrosis as scar formation of the site and permanent obliteration of the hemorrhoidal vein. So after 7 days, what happens? Just you think. See, this is a proctoscopic view. Yeah, after 14 days, it's almost everything is sloughed out. Now it is healing. This is, yeah. After 30 days, now completely healed. This one is completely healed. There is no Arshas at all. You can see just after 30 days. I will show you cut proctoscopic view also. See, cut proctoscopic view. That's just a linear scar. You can see whole bile mass has gone. This is what happens with the Kshara Karma. See, such a big Arshas just after Kshara Karma by 30 days, everything is healed. This is the advantage of Kshara Karma. Some place fibrosis, a linear scar, just a line, linear scar is there. So this is the thing. This Agni Karma is burning. Now you have seen for external piles, centine pile, fishery nano. Karkasha, Stira, Proto Kathina. Karkasha, Stira, Kathina, go for Agni Karma. This is what just burning the tissue. Anyhow, you have seen now already. So advantage is this procedure is minimum hospitalization. If you are doing one piles at a time, I think you can do as a OPD procedure. Just definitely as a OPD procedure. If you are doing all 3 piles in single sitting, better to do under local anesthesia you can do, or with the spinal also, because you are dealing a more area. Patient may have to be admitted for 1 day, then patient can go home, and less pain when compared to conventional surgeries. Recurrence very less, and cost also very less. Cost is surgeon dependent. If because of minimum hospitalization and minimum medicines, I think the cost will become very less to the patient. These are the advantage of Kshara Karma. So Kshara Karma is not Kshara Lepa. Sometimes I think people say it's a Kshara Lepa procedure. Actually, it's a Kshara Karma is done by surgeon. You are deciding how much should be applied, all these things. Agni Karma for external piles. In Dushta Varna, like Sendam fishery for Kshara Karma. So same Pratisaranya Kshara can be used in different conditions like Bhagandara, pylonitis sinus, carcinoma in situ, non-healing ulcers, non-diabetic. It is an excellent thing. If you apply this Kshara, non-healing ulcers very beautifully it will heal. And rectal flaps, tonsillitis, skin diseases. Some of these skin diseases you get a very excellent result. It is cured permanently. So another thing, what I recently came to, I am using it. This Kshara, you apply for this warts and this one Kadara, that is Kadara in leg. You apply this Kshara daily. Tell the patient to apply this Kshara. I think Madhyama Kshara is sufficient. Don't give Tikshna Kshara. If you apply daily, that goes off completely without, if you do surgical excision, there will be recurrence. By applying this Kshara, to completely softens, it will go off. Very easily it can be removed. Then coming to, I think, Kshara, Agni and Shastra. Shastra, I hope everyone is knowing, just excision or ligation. Should I have not shown here, because conventional surgery everyone know. Coming to medicinal treatment, today is World Piles Day. I think the surgeons can do all these procedures. Primary level physicians like BMS doctors or primary family physicians, they can do. They treat the patients. A vast populations can be treated with the medicinal treatment. So how they present us, I think I will discuss for about 5 to 10 minutes about medicinal treatment, because it's very important. So any family physicians, general practitioners, what we call, their role is very important in treating the population. I think so. The surgeons are treating the only limited number of patients, but these general practitioners, they are treating vast number of population. The mitigation of the society can be removed. Why I am saying this Arshas is Durnama, it is told. It is a Mahavyadhi. Why it is Mahavyadhi? Because of Arshas, there will be Udavarta. By Udavarta, Anaha, you will get Rudroga and stroke, Parkinson's disease. So many diseases of neurological, cardiac diseases and renal diseases, will occur due to udavarta. That is reversing of the intestinal movement or any movement outside external movement of the waste products are reversed back, udavarta. So if it happens because of Arshas, because of block, it will happen. So many patients will get all other serious diseases. If you prevent in the primary level, this Arshas going very serious level, I think population can be treated, get a healthy lifestyle. So how they present us in a clinic? Usually, a patient come to you with Arshas is bleeding. This is usually they come. Then second area, when there is a pain, they will come. When there is a mass feeling, they come to you. These three things. If mass feeling is there, size increases. This mass feeling can occur either by third degree or fourth degree piles, or there may be thrombosis. There may be external thrombotic pile may be there, or internal piles may be thrombosed. So there may be mass feeling, just increase of the size also, there may be mass feeling. When thrombosis occur, there will be pain. So pain, otherwise usually pain will not occur. Or other than Arshas, if there is a sentinel pile, then also mass and pain will be there. Or hypertrophic anal papilla, then that also patient feels the mass and pain. These two things can occur. Bleeding, when there is a cut is there. When hard motion comes, there is a cut, then there will be bleeding, but with the pain. But bleeding by Arshas, that will be always painless. So this bleeding, maybe less bleeding will be there. Some person will have less bleeding. Some person will have severe bleeding. Some person may have clots. So just bleeding and giving some coagulant drug, I don't think, as a coagulant we are giving some herbal drug, I don't think it becomes Ayurveda. In Ayurveda, we should think always, when the internal medicine should be always given according to Tridosha concept. So this bleeding, when bleeding is there, Sushruta says, Rakta Pitta Vata Chikitsa. Rakta Pitta Vata Chikitsa. For Rakta Pitta, always Gruta is advised. So this Gruta, there are many Grutas are there. Which Gruta you should give? When severe bleeding is there, that is a Kevala Pittaja Arshas. Then you give Kashaya Rasadravyas, Ashoka Gruta, or Lajjalo Kashaya, or Ushira, so like that you should give. If it is bleeding with the clots, thick blood is there, that is Kapha Samsargaja, then you go for Tikta Rasadravyas like Utaja, Kutaja Rishta or Kutaja Gruta, Kutaja Ghanamati should be given. When there is a less bleeding is there may be pain, may not be pain, but because of rukshat of vayu, vata samsarga, there will be less bleeding, go for Madhura Ganavashadi Gruta. Or Shatavari Adi Gruta you can give, Shatavari Kshira Kashaya you can give, it's a Madhura Ganavashadi. By that bleeding will stop. If it is a Kapha Samsargaja, if you give Shatavari you will not get result. If Vata, if you give Kutaja also you will not get it, because Kutaja Tikta Rasa, due to Ruksha Gana, Vata will not decrease. So always you should think according to dosha and select the drug. When pain is there, usually we should prescribe some gugulus. There will be Runa Shota is there, Raktavarana, Vata Prakopa. Different gugulus should be given as Amapachana. Usually Gandhakrasa and Trifala Gugulu is the drug of choice in such cases. And Abhaya Arishta, so or Abhaya Haritaki, this is the drug of choice. When the mass feeling is there, to reduce the size, you use Haritaki. So if you thrombosed by Haritaki and give sits bath with the application of Jatya Taila. These three things can be done. Always, if a patient comes with these feelings, you should see the patient. You observe the patient, examine the patient from outside or inside by proctoscopy or by finger. You diagnose it. What happened there? Is it thrombosis or only plain Arshas? Is it fissure? Is it hypertrophy anal papilla? Everything you should see. You should think surgery is needed or by medicine only. So always better to, if it is treatable with medicine, always treat with medicine. Then in Ruksharsas, I think Balatang also advised and Chitrak also advised. So there are Gutikas, Gandakrasayana, Haritaki, Kamadvid Mukta. The Pittajarshas always Kamadvid Mukta is drug of choice. Golaparpati, Gugulus, Trifala, Gugulu Chandraprabha, Grutas, Changeria Gruta, Potaja Gruta, Ashoka Gruta. So some persons with the mass feeling, they come with Arshas. If you see, it may be rectal collapse also. So you should explain what is the condition. Like that, you have to treat. By Kshara Karma, you can treat, or you can go for other surgical procedures, or you can go with just Changeria Grutha also. Patient gets very nice result with the, if a primary level of Buddha you can treat with Jangeria Grutha and Haritaki. It reduces by itself. Slowly it goes off. This can be done. So then Churnas, Vaishwara Churna, some patient comes with the Anaha and Admana. What's the difference between Admana and Anaha? See, both there will be flatulence. In the Western science, they will say only flatulence. But according to Ayurveda, Anaha is there, Admana is there. There is a difference. When there is a constipation with the flatulence, we call it as Admana. When there is a loose motion with the flatulence, we call it as Anaha. When Anaha is there, you give Hingvashtaka Churna. When Admana is there, you can give Vaishwanara Churna. This is the difference. See, beauty of Ayurveda is, according to Ayurveda, thinking is very important as an Ayurvedic surgeons. So is it Anaha or Admana? Just you change the drug. If there is a loose motion with the flatulence, if you give Vaishwanara Churna, you will not get result, but you give Hingvashtaka. If Admana, there's a constipation with the flatulence, always better to give Vaishwanara Churna, not Hingvashtaka. So I think this understanding may be useful for all clinicians. So Avipatigara Adimashtaka, Amalaki Churna, Taila, Kashi Sai Taila, Estima Taila, Jate Taila for application and sits bath. Asavarishta, Sushira, Samsta, Kotajarishta. According to need, we should use. So that is why Taraka says, Hetu Linga Vishadam Jnanam, Sastatra Parayanam. A medicinal treatment, always patient comes with the linga, signs and symptoms. Then you have to find out Hetu. To that Hetu, you have to give Aushada. Hetu is always thinking according to doshas, Nasti Rogo Vina Dosha, Asma Tasma Vichakshanaha. Anuktama, even it is not Doshanam Lingahi. In that Vyadi, you have to see Doshanam Linga. In the bleeding per rectum itself, you have to see Doshanam Linga. Is it Vata Pradhan, Kevala Pitta, or Vata Samsarga, or Kapha Samsarga? This Doshanam Linga analysis should be done and give the treatment. Just giving that Linga a treatment, not. There you have to see, analyze which dosha involved, Hetu involved, then you give the treatment, you get success. And why I am saying, even post-operative treatments also, in post-operative we are giving Gandhakraj Trifala, then also you have to see according to his Prakriti and his science symptoms. You can use Kamavid Mukta, you can use Agnitundi, you can use Makaradhvaja. According to dosha analysis, you can do, you can give Soothshekara like that, you can give different medications. Where many of the modern analgesics you can avoid with using the Ayurveda drugs. So Satatadhyanam, Vadaha, Paratantravalokanam, Tadvidyachara Sevacha, Buddhimedha Karo Ganaha. So what I am advising to all the students, I am especially students and even practicing Vidyas also, always you do Satatadhyana, Vada, discuss each other, any clinicians discuss each other about the different presentations, which dosha involved, then which drug should be given. Paratantravalokanam, contemporary science should be studied, and Acharya Seva, you get the advice from Acharyas, or if you want, you get practical experience with the Acharyas. Even for medicinal treatment also, it's better you get Acharya Seva. Advice from, do Seva of Acharya, that means you get practical experience. Learn practical experience and give the proper treatment. So with this, I conclude my presentation, thanking Dr. Hemant, Dr. Sanjeev, and others for giving this opportunity to share my experience of treating Arshas with the Kshara, Agni, and Shastra, and Kshara Sutra, and different procedures. So I am very thankful to all of you for patient hearing and wishing you all the success in your future endeavor. I will conclude my presentation. Thank you very much. Thank you, sir.
Thank you very much, sir, for giving us time from your tight schedule and give us a vision of use of Pratisharnya Shar in the hemorrhoids on this Piles Day. Now, proceeding forward, I would like to invite our second guest speaker, a very renowned personality in field of proctology as well as general surgery, Dr. N.K. Malpani, sir. Sir is designated as Chief Surgeon and Director of Malpani Multi-Speciality Hospital, Jaipur, and sir is also a Professor of General Surgery. Sir did his MBBS in 1968 and MS in General Surgery in 1972 from SMS Medical College, Jaipur. Sir has got very innovative mind and started many procedures for the very first time in the state of Rajasthan, like gastroscopy, colonoscopy, etc. Sir pioneered surgeries like laparoscopic surgery, laser surgery in piles, fistula, and varicose vein in Rajasthan. Sir has got many publications and research work at his credit. Sir has conducted many live workshops for piles by various methods like bending, laser, and MIPH, etc. One live demonstration on laser hemorrhoidopexy was also conducted by sir in our institute too. So I request to Dr. N.K. Malpani sir to enlighten us with his knowledge on the topic recent trends in management of hemorrhoids. Over to you, sir.
Koju, am I audible?
Yes, sir.
Am I audible?
Yes, sir. You are audible, sir.
Thank you very much. At the onset, I want to thank Professor Hemanta Kumar, Dean, NIA, who has given me this opportunity to share my experiences to this august audiences. I will try to make the primary concept of the piles and their pathology, etiology and pathology, and because that will give an idea that which piles and at what condition what should be the applied. The applied application of the different methods. There are a lot of methods as Dr. The previous speaker has told us there are so many methods in Ayurveda also and in allopathy also. That as we all know, the piles are known as bawasir or masse in general public. पाइल्स बीमारी गुदा की यानी मलद्वार की बहुत सामान्य बीमारी है। अगर मैं कहूँ 40% पॉपुलेशन जनसंख्या पाइल्स की बीमारी से पीड़ित है, दैट इज अ लार्ज पॉपुलेशन, सम प्रेजेंट टू अस, सम डू नॉट प्रेजेंट टू अस। बीमारी का मुख्य लक्षण जो डॉक्टर के पास पेशेंट को लाता है वो रक्तस्राव है, रक्त बहना है। इसके अलावा अन्य कई लक्षण होते हैं जिस पर प्राय मरीज हमारे पास नहीं आता, जैसे पेरिएनल खुजली चलती है, भारीपन रहता है, और कई तरह के हल्के फुल्के दर्द रहते हैं और खून ज़्यादा चला जाने की वजह से कार्य में थकान और अरुचि पैदा हो जाती है। यहाँ तक कि कई बार खून भी चढ़ाना पड़ जाता है। पेशेंट 2, 3, 4 हीमोग्लोबिन पर भी प्रेजेंट करते हैं। दिस इज अ वेरी फ्रीक्वेंट presentation of these patients. Hemorrhoids are, if I go for the anatomy of the hemorrhoids, hemorrhoids are nothing but cushions of the specialized highly vascular tissue with thickened submucosa containing sinusoids connected and smooth muscles. They are also present, but when they become enlarged and they displace downwards, then they are known as hemorrhoidal disease. Are you listening? Oh, I am audible. Main function
Yes, sir, you are audible, sir. Perfectly, you are audible, sir.
So, so these hemorrhoids are very sensitive part of the anal canal. Sometimes I call them, they are the eye of the anal canal. They are so sensitive. I sometimes teach my students that you should respect the anal canal like an eye, because this is the part which keeps us social. This is the part of the anal canal. These cushions are so sensitive that they recognize whether we are passing air, whether we are passing fluid, whether we are passing hard stools. But sometimes they give false sensation due to so many pathologies like hypertrophic papilla. They constantly stimulate these cushions and gives us false sensation of so many problems, and that I will discuss later on. So the main function of these cushions is continence of the anal canal. That I have already told you that the continence of the anal canal is maintained by make a the enlargement and displacement of these cushions with various symptoms is referred as well. When these cushions enlarge and displace downwards, then we call them hemorrhoids or piles disease. The displacement of these cushions occurs due to so many reasons. The section of the anchoring tissue of these cushions. This is known as sliding anal canal theory. Because of the so many pressures in the abdominal canals and at the time of defecation, the these cushions are adherent due to connective tissues to the deeper muscles, and because of the pressure, these cushions enlarges and displace downwards, and then they bleed many times. So the various causes for this displacement and enlargement are: one is the most important cause is constipation and prolonged straining. When patient sits in the toilet for a long time, many times reading the books, etc., for longer duration, taking not care of the straining and irregular bowel habits, that this is a very important part which I want to discuss. That those who are frequent travelers, they do not reach to their destination in time, and they avoid the calls, normal calls of the defecation. And at that time, there is a normal, constant irritation of the anal canal. And this irritation gives enlargement of these cushions leading to the piles. So this is very important. So one should have a regular bowel habits, and for long years together, one goes for irregular bowel habits, then he suffers piles. Pregnancy, we all know that is increase in abdominal pressure causes piles. Erect posture, this is said that this is the price man has to pay for the erect posture. He has asked for the erect posture to the god, and but he has to pay for in the form of piles. Aging leading to the decreased support of the anal canal. This is also very important, because as one always achieve the age, and the muscles become weak of the perineum, and this anal complex becomes weak, and there is a displacement of the cushions. Hereditary factors, the parents suffer piles, and so that sometimes the children also suffer the piles. Enlargement of the prostate and stricture urethra. This is a very important point. While we are examining the patient and taking history of the patient, one should not forget to take the history of urination. Defecation we always ask, constipation we always ask, and so many other things we always ask. But this part is usually missed by most of the people, that whether one is passing urine nicely or without straining. And if we do not treat the prostate or stricture urethra, the recurrence is bound to occur. So this is very important, and the recurrence will bring discredit to the treating surgeon. So this is very important. Simultaneously, prostate and stricture urethra should be dealt with along with the piles. Here I want to stress upon one thing, that internal hemorrhoids you can see higher up, and internal rectal plexus on the opposite side. So Yeah. So when we strain, this is the internal hemorrhoidal plexus, and when we strain, the pressure goes to the external hemorrhoidal plexus. This is the external hemorrhoidal plexus. So once the internal hemorrhoidal plexus develops, then external hemorrhoidal plexus also becomes called the external hemorrhoids. So most of the time, what I want to stress on at this point, that most of the time when we treat the internal hemorrhoids, the external hemorrhoids subside 90%, but skin tests still remains, which need not to necessarily to cut and dealt with. If the patient is very much interested, then one should do it for that purpose. Otherwise, most of the time, external hemorrhoids subside once we treat accurately the internal hemorrhoids. Then we all know the various degrees of the piles. The first degree piles are those which only bleeds and remains inside the anal canal. The second degree piles, when we strain, they come out, but they go back once the process of defecation is over. They regress automatically. In the third degree piles, the piles comes out, but they require manual reposition by finger or hand. And in fourth degree piles, they do not go inside, and many times they get thrombosed and becomes painful. So again, if I say the first degree piles में मलद्वार में सोच जाते समय, मैं हिंदी में कुछ बताना चाह रहा था, बोलना चाहता, कुछ ऑडियंस शायद ज्यादा फायदे में रहेंगे. फर्स्ट डिग्री पाइल्स से मलद्वार में सोच जाते समय दर्द रहित रक्तस्राव होता है, जो कि बूंद बूंद या पिचकारी की तरह आ सकता है. इसके अलावा मरीज को मलद्वार में खुजली या जलन भी महसूस होती है. दिस इज अ वेरी इंपॉर्टेंट पॉइंट. एट दिस स्टेज मेनी टाइम्स पेशेंट कम्स विद खुजली, जलन एक्सेट्रा एंड थोड़ा भारीपन. So at this stage, we should do proctoscopy and find out whether one is suffering with piles or not. So if one is suffering with piles or any skin disease, that has to be ruled out at this stage. In second degree piles में दर्द रहित रक्तस्राव होता है. सभी उपरोक्त बताए गए लक्षण होते हैं, दैट इज खुजली, जलन एक्सेट्रा. परंतु इस स्टेज में पाइल्स सोच के समय मलद्वार से बाहर आने लगते हैं और सोच प्रक्रिया के बाद में रक्त स्वतः ही अपने आप अंदर चले जाते हैं. दिस इज सेकंड डिग्री पाइल्स. इन थर्ड डिग्री पाइल्स में ये सब लक्षणों के साथ में सोच की प्रक्रिया के समय मस्से या पाइल्स बहुत ज्यादा बाहर आ जाते हैं और उनको वापस अंदर करने के लिए हाथ या उंगली के दबाव की आवश्यकता पड़ती है. कभी कभी सूजन आने से दर्द भी होता है. वैसे नॉर्मली पाइल्स में दर्द नहीं होता है, परंतु कभी कभी होता है. इन फोर्थ डिग्री पाइल्स इन फोर्थ डिग्री पाइल्स में हमेशा दर्द होता है तथा खून गिरता है. पाइल्स मलद्वार में पूर्णतः बाहर आ जाते हैं तथा प्रयास करने पर भी वापस नहीं जाते. पेशेंट अगर मैनुअली उनको अंदर डालने की कोशिश करता है तो वो नहीं जाते. समय पर उपचार नहीं करवाने पर इन्फेक्शन हो जाता है और गैंग्रीन भी हो सकती है, जो सेप्टिसीमिया और जानलेवा हो सकती है. This is another way of deciding the classification of piles. In addition to first degree, cursor. In addition to the first degree, second degree, and fourth degree piles, one has to decide A, B, C, D. These stages of piles. This is very important because it's not the first degree, second degree, third degree, and fourth degree piles which are important. How much size of the pile is there in first degree or second degree or third degree? The size is very important because any procedure, any conservative procedure, whether Kshara as described or anything else conservative, that amount of the drug and treatment, whether laser or sclerosant injection, which we will discuss later on, that depends on the size of the pile mass, not the degree. So to achieve the best results, one should know the size of the pile mass. So we can further divide these first, second, third, fourth degree piles in A, that is single pile mass, only one pile. B, two pile, but less than 50% circumference involving. C, circumferential piles occupying more than 50% area of the anal canal. And D, thrombose or gangrenous piles. In addition to that, they are originating above the dentate line. They are internal piles, and those originating from the below the line, they are external piles. So how to decide this A, B, C, D? That is very important. While you are doing proctoscopy, ask the patient to strain to some extent, and that will give the best idea that what is the size of the pile. Once the patient in knee elbow position and without straining, or in side position and without straining, that will not give the correct idea of the size pile mass. So ask the patient to strain slightly. That will give you the A, B, C, D, etc., and it will be helpful always in finally deciding the amount of the energy given, like in laser or other things to be done. पाइल्स, आम आदमी किसी भी गुदा की बीमारी को पाइल्स कह के ही फिजिशियन या क्लिनिशियन, वैद्य या डॉक्टर के पास आता है। इसके साथ बहुत सी बीमारियां होती हैं, केवल मरीज की भाषा केवल पाइल्स होती है, परंतु अपने को एग्जामिन करके ये डिसाइड करना है कि फिशर है या नहीं, क्योंकि और बीमारियां जो भ्रमित करती हैं वो फिशर है। फिशर में सबसे छोटे शब्दों में मैं कह सकता हूँ कि सोच के समय बहुत ज्यादा दर्द एवं कभी कभी रक्तस्राव होता है। इट्स अ वेरी एक्सक्रूसिएटिंग पेन फॉर 3-4 आवर्स आफ्टर द डेफिकेशन, दैट इज फिशर। पाइल्स में इतना दर्द नहीं होता अनटिल अनलेस दे आर 4th डिग्री पाइल्स। फिस्टुला, मलद्वार के पास छेद से दर्द के साथ रक्त मवाद आना, और इसमें एक पास्ट हिस्ट्री होती है प्राय कि पेशेंट को कोई एक्सेस डेवलप हुई हो, पेन डेवलप हुआ हो, दैट गॉट बस्ट एंड डेवलप द फिस्टुला। सो दैट पास्ट हिस्ट्री इज वेरी इंपॉर्टेंट इन दीज केसेस। पेरिएनल हेमेटोमा, इसमें भयंकर दर्द के साथ गुदा किनारे खून की छोटी गांठ होती है। दीज आर यूजुअली एक्यूट। Suddenly, there is at the time of defecation, even sneezing can cause perineal hematoma. Prolonged traveling, sitting for a long time, that may cause perineal hematoma, and that should be excluded from the piles. Sentinel piles and periischial tags, as we all know, they are external piles and sentinel piles are also there. So, बाहर लटकती हुई चमड़ी होती है, कभी कभी इसमें दर्द, खुजली या गीलापन महसूस होता है। Hypertrophic papilla, as Dr. Javed has mentioned, they are very bad things. In other words, they are ignored by most of the physicians, but they are the cause of so many things. Not even the चुभन और सोच जाने के बाद मल निकलने की इच्छा बनी रहना, that is the most important thing. Pseudo constipation, what I call it pseudo constipation. Patient कहता है कि मुझे सोच जाने के बाद ही इच्छा बनी रहती है मल निकलने की, दैट इज बिकॉज ऑफ हाइपरट्रोफिक पेपिला। इफ यू डू नॉट ट्रीट हाइपरट्रोफिक पेपिला, पेशेंट विल नॉट गेट फुल रिलीफ ऑफ हिज प्रॉब्लम। So that should be examined properly, and proctoscopy, sometimes they are palpable with the finger on PR examination, but proctoscopy is the best thing to decide for hypertrophic papilla. Anorectal polyp, which is most of the time found in the children, but many hypertrophic papilla may become so large that they mimic like a anorectal polyp, and that has to be tackled along with the piles and other problems. So, and sometimes they cause bleeding also. Rectal and anal prolapse, गुदा के अंदर की चमड़ी का बाहर आना. This is I take it very important point in the sense that many people do not suffer piles and only have got anal prolapse. How to decide this? That can be decided on proctoscopy. Patient's history is very important, but on proctoscopy, when you ask the patient to strain, then the mucosa of the rectum will come out in the canal of the proctoscope. So that is very important. The anal prolapse and piles may coexist, but sometimes only anal prolapse, and that should be treated different than the piles. So that is important. One should rule out. This is a very important point, and on clinical examination one can decide it. No other test will be helpful in this case. Anal and rectal cancer. This is a very worst part, that many times people do not do cancer rectal examination or proctoscopy examination. This is my experience. Even I have missed many times. I can give an history. One VIP, he refused me to do PR and proctoscopy. He came with a bleeding anal canal. So thinking that he is VIP, I should not do. But after 1 week, when he returned, he was not having any relief by my treatment, and I insisted him to get PR done. When I did the PR, to my surprise, he was suffering with the rectal cancer. So one should not avoid PR and proctoscopy examination, and nowadays colonoscopy or sigmoidoscopy are available. They should be done in as many as patient whenever you suspect something more than piles. And perianal abscess, this also seen in some patients. They come as a piles, but when we find there is a perianal abscess. पायल के कारण कुछ अपन आगे पहले डिस्कस कर चुके हैं, पर लगातार कब्ज रहना, दैट इज फॉर ए लॉन्ग ड्यूरेशन, कब्जी का रहना मुख्य कारण है। वंशानुगत, आई ऑलरेडी टोल्ड, माता पिता के पायल्स होते हैं तो संतानों के भी हो सकते हैं। लगातार लंबे समय तक बैठना व बार बार लंबी यात्रा करना भी पायल्स का एक कारण है। लंबी यात्रा की वजह से कई लोग टाइम से वो बस या ट्रेन टाइम से नहीं पहुंचती जगह पर, तो वो अवॉइड करते हैं अपने कॉल्स को। दैट इज आल्सो वन ऑफ द इम्पोर्टेंट थिंग विच प्रोड्यूसेस द पाइल्स। मोटापा, ऑफ कोर्स एवरीबडी नोज इट, गर्भावस्था ड्यू टू इंक्रीज प्रेशर ऑन द पेल्विस, किसी कारण से लंबे समय तक, आई ऑलरेडी डिस्कस इन डिटेल दैट प्रोस्टेट एंड स्ट्रक्चर यूरेथ्रा इज वेरी इंपॉर्टेंट। और इन फीमेल्स में प्रोलैप्स और बच्चेदानी या पेशाब की थैली का प्रोलैप्स वो बहुत इंपॉर्टेंट है। प्रोलैप्स यूट्रस और सिस्टोसील और रेक्टोसील, दे आर द कॉज फॉर पाइल्स फॉर्मेशन इन फीमेल्स। This cirrhosis of liver and portal hypertension, that is usually missed by many people. One should, they do not see the other parts of the abdomen, and they do not ask the history of alcoholism or other things. So that part has to be considered while taking the history, that patient may not be suffering with cirrhosis of liver and leading to portal hypertension and piles. Because in portal, when treating the piles in portal hypertension, one has to be very careful. Otherwise, there will be torrential bleeding after the treatment, and it will create many problems. So portal hypertension should always be ruled out in these cases of piles, especially those who are alcoholic. Piles के इलाज, कब्जी का निराकरण, we can discuss a few in the title form. The कब्जी का निराकरण पाइल्स की संकुचित करने की दवाएं, that is venotonic drugs, संकुचित करने की दवा venotonic drugs. There are lot medicines in Ayurveda. I do not deny in this fact that Ayurveda has got so many medicines which can contract the piles, and venotonic, so-called venotonic drugs, and they are available in allopathy also. And कब्जी का निराकरण is important. इन कब्जी के निराकरण में जो मैं already discuss कर चुका हूँ कि prolapse of the anal mucosa or hypertrophied papilla, they give a pseudo feeling of not evacuating completely, and patient goes on straining and develops the piles. So one should be very careful while asking No, it is not only what is kabji. Sometimes patient comes that he is unable to pass the stools. That is one type of kabji. Sometimes patient says that he has to go 3-4 times. He also calls that kabji also. And many times patient says that he keep on sitting, and small amount of the fecal matter come and he strains. This is also called kabji. तो इस तरह के जो पेशेंट होते हैं जो बैठे रहते हैं और उनको बहुत ज्यादा स्ट्रेन और लंबे समय बैठने के बाद थोड़ा सा अमाउंट स्टूल का आता है, वो प्राय हाइपरट्रोफिक पेपिला या प्रोलेप्स एनल कैनाल या रेक्टल कैनाल की प्रोलेप्स के पेशेंट होते हैं, एंड दैट शुड बी टेकन केयर. Only giving laxatives etc. will not cure their kabji. So one should be careful to decide what is the type of kabji is there. इन्फेक्शन होने से एंटीबायोटिक्स की दवाएं पाइल्स में दी जा सकती है. प्योरली पाइल्स में इन्फेक्शन प्राय नहीं होता. व्हेन दे आर इन 4th degree, दैट इज पार्ट ऑफ द व्हेन वी रिक्वायर दर्द की दवाई और एंटीबायोटिक्स. स्क्लेरोथेरेपी इंजेक्शन is another way. It is an office procedure that can be treated, and it is gaining now with the good sclerosants. We are treating the patient by pure sclerosant as well as foam therapy, which I will discuss later on. So this is an office procedure and gaining lot of popularity, like Shara, as you have discussed, but there is no necrosis of the tissues in this case. That's the most important thing, and it is competing with the laser. MIPS, minimal invasive procedure, एक गन द्वारा होता है जो आजकल बहुत पॉपुलर है, परंतु recently after 10-15 years the recurrence rate is coming with this procedure also. This is a painless procedure but requires admission in the hospital. Elastic band ligation and ligation, this is office procedure. The only problem in this case is sometimes there is necrosis and post-operatively bleeding is there in these cases. Otherwise, it is also a day or office procedure. Radio frequency, like laser, it is equally good. Here again, I want to say that in this elastic band ligation and radio frequency and in laser and sclerotherapy, mass of the pile, size of the pile, and then deciding the amount of the energy given or stimulating the tissue by the band or amount of the radio frequency given is very important. Here comes the importance of the judging the size of the pile or mass of the pile is very important. Sometimes at the normal pile, along with the normal pile, there on the side there are small piles. Some people call them secondary piles. I many times call them daughter piles. So they should be taken care in these cases. These daughter piles should be taken care by every surgeon. Excisional surgery of the piles is well known from the past, but it is a very painful procedure. It requires a lot of rest by the patient, which people do not like nowadays. लेजर विधि ये लेटेस्ट प्रोसीजर है. एक दिवसीय दर्द रहित ऑपरेशन है, यानी डे केयर प्रोसीजर है. इसके अलावा मरीज की जनरल कंडीशन एवं साथ में शरीर में अन्य बीमारियों को ध्यान में रखते हुए अलग अलग मरीजों में अलग अलग विधि द्वारा इलाज करना होता है. ये सभी प्रोसीजर हर पेशेंट में लागू नहीं पड़ते, ये मेरा कहने का मतलब ये है. और पेशेंट डायबिटिक है, हाइपरटेंसिव है, कार्डियक पेशेंट है. जैसे कार्डियक पेशेंट में हम एक्सीजनल पाइल्स नहीं कर सकते, उसको एनेस्थीसिया देना बड़ा मुश्किल होता है. डायबिटिक पेशेंट में वन हैज टू बी वेरी केयरफुल that any cutting procedure might produce septicemia and other things. So one has to be very careful that one should not see the anal canal and perineum in a piles patient. Patient should be examined completely for the general condition of the patient and associated problems. That is very important. Otherwise, they all will bring discredit to you. This is another way, in short, to decide the type of that is by treating only by other methods is not enough. So one should have dietary and lifestyle modification. The piles is known as lifestyle problem. This is because of the lifestyle problem, and that is uh, fiber therapy should be given to these patients to treat the constipation, and to give a satisfactory evocation is there that the bulk amount of the fecal matter comes, patient feels very much satisfied in these cases. So and then laxatives and bulking agents and yoga therapy to improve the tone of the pelvic muscles is very important. Now, as a medicinal therapy, the microfine purified fluorides is very important. This is almost a Ayurvedic preparation which has been microfine and purified and gives very good results and definitive results in these cases. Calcium dosinate is another agent. These are venotonic drugs. Topical venotonic drugs are also available, and other venotonic adjectives. Lot of venotonic drugs are available nowadays. The non-surgical office procedures, which are I was describing repeatedly, that office procedure. Now people like office procedures or daycare procedures in these cases. So rubber band ligation is one, but it has got its own problems, which I will discuss later. Injection sclerotherapy, which now has been converted into foam therapy also, which I will discuss later. Infrared coagulation is another, and diathermy by cautery, or nowadays other diathermies are available that can be used. Hemorrhoidectomy is one procedure, surgical. It's a very big procedure that I will also discuss later in slight detail. And staple hemorrhoidectomy, that can be taken as a non-surgical procedure sometimes, but hemorrhoidopexy is the one which staple MIPH is the one. Transanal hemorrhoidal de-arterialization. One feels there is an ultrasound type of machine is there, and arteries felt there, recognized, and that should be ligated along with the piles, and that gives very good results. But the problem is to have an instrument and to recognize the artery also important. And other surgical procedures are also there. This is MIPS machine. I will not go in detail of the procedure, but this is the gun which has got the here there are stitches or the pins are there, and these are the various things which can be used, and that is how this procedure is done. That we put this proctoscope like this, we hold all the piles. The mucosa is a circular suture is given around, and it is brought into the proctoscope. Then the gun is placed. This one part of the gun is placed above the circular suture, and the pile is bring down below the gun in the cavity of the canal of the gun, and then it is closed completely. Like this is open one, this is closed completely after pulling the mucosa along with the piles, and then we fire. After firing, this is the mucosa is cut along with the piles, as well as there is a suturing, and the procedure is post-operatively almost painless, but it requires general anesthesia. Some people have started doing under block, the local block also, so that can be done. But recently recurrence rate, maybe because of some technical problem, or the various companies are not giving good staplers also. These are the instruments used for the ring application. So there are two types of these proctoscopes we require. There are, this is a gun, this is one type of the ring applicator, this is another. Here we suck the pile mass in the cavity, and then we apply the ring. Here we hold the pile mass with this forceps and pull it in the drum of this machine, and then we apply the uh, like this, we we pull the pile mass in the drum, and then this is the mass. Then we apply the ring here. We can apply one or two rings simultaneously. The some people, along with this gun ring application, they inject the sclerosant also in these piles to deal with. But many times in this case, the total pile mass doesn't come in the drum. So a bigger pile mass, they cannot handle the very big pile mass. So one has to decide which pile should be given bending or not, or one should give many times all three piles should not be dealt with simultaneously. Otherwise, they may cause lot of problems post-operatively, including stricture. The one of the important disadvantage of the ring application that the pile become gangrenous. Sometimes they get necrosed, and I have seen many patients coming back with profuse bleeding in these cases after the bending, and bending gives necrosis. This is the type of necrosis we see on the proctoscope. And they fall, the gangrene falls, and there is a severe bleeding in these cases. This is how the foam is created. Not only the pylodicol polydoconal injection is taken into syringes and foam is created. This gives the things are under study. It gives a better result. People say, those who have done a lot of cases, they say this foam sclerotherapy gives better results, especially in cases of circumferential piles. And that is how I do for the sclerotherapy, that I hold the pile under local anesthesia like this, and pile is nicely seen in the cut type of split type of proctoscope, and you can very easily and nicely can give injection, and very properly injection is given in this case. Only by proctoscope seeing the piles, the injection is not given so properly, and depending on the mass, the amount of the sclerosant can be injected, and the results are fine. I am doing this study comparing the laser with this foam sclerotherapy and foam sclerotherapy, and due course of time we will provide the results which is the better. This is surgical excision of hemorrhoids. There are two popular methods. Ferguson technique. In this technique, we excise the pile like this, and then we suture the mucosa partly and leave a small amount to drain the blood or serum, etc. In this, the another procedure, the Morgan procedure, here we excise the pile in similar type, excising, and leave the wound open for healing. So these are the two popular procedures, but they are the ultimate in the sense that recurrence rate after surgical excision is almost zero. The only problem in these procedures that they require a lot of rest, there is a lot of pain, they require a lot of analgesics. The worst part, if not properly done, stricture formation is the worst part of this operation. So they should be done. Always one should leave a bridge of normal mucosa in between the two excised piles, so that will prevent the stricture. So one should be very careful doing these procedures. We are not doing these procedures nowadays very much because people like recurrence than that suffering from pain, etc., in post-operative period. Now I will talk something about the laser, which is the latest tool in our armamentarium for treatment of the piles. I have heard that not many Ayurvedic people are using laser laser machine providers or the sailors say that the Ayurvedic people are purchasing more laser machines than the allopathic people. So this is a very interesting feature, and it's a very painless procedure. So laser therapy of the piles is now well established minimal energy surgical procedure. Here again I want to caution that the mass of the pile, how much energy to be delivered. I have done thousands of patients of laser piles, but the recurrence is there because the proper energy was not been applied in the sides of the piles. So the daughter piles or secondary piles do not subside by the laser. Many times there is a excessive energy given, and there is a burn of the mucosa, and energy reaches to the muscles, and post-operative pain is severe in these cases. And if not properly applied, patient has reported to me after the stricture formation after laser. If improperly applied, laser gives stricture formation also. So the technique is very good, technology is very good, but a proper application is very necessary. So this is how I do laser, that I hold the pile like this to see the pile mass, and then you can see the light is there. With the light you can judge from where you are starting to giving the laser. This is the light you can see here. Light is there in the laser tip, and one is very sure that how much laser and where to be applied. In secondary piles also, again I am repeating for the purpose. So in this also, that laser should not be applied below the dentate line. If you apply the laser below the dentate line, it will be very painful procedure post-operative. So surgical removal of these cushions in order to treat the piles may lead to anal canal incontinence. Considering this fact, the laser is a very good procedure. Hemorrhoidopexy seems to be, hemorrhoidectomy is a very painful procedure. The hemorrhoidopexy procedure which you have described, all these bending, sclerotherapy, laser, radiofrequency, these are hemorrhoidopexy procedures, and these are the ideal procedures we can say for the treatment of piles among the various surgical procedures available in our armamentarium. Because these are the hemorrhoidopexy procedures which I already, MIPS has also been included into the hemorrhoidopexy nowadays. They are less painful, they require less hospitalization or sometimes no hospitalization, and loss of work is minimum in these cases. So sometimes I tell the patient that you are being treated free by these procedures because your earning will not suffer. He require 1 or 2 days rest, and then he can go to his work. So there is no loss of work and no loss of economic loss is there along. So what laser does? Firstly, this is a laser fiber we inject. That is above the muscles, below the subcutaneous muscles. That should be a properly placed laser fiber is very important. So firstly, laser fiber ablates a bunch of the vessels. So these bunch of the vessels is ablated. They shrink because of the laser energy, and the pile gets replaced. It ascends because of the shrinking. So without damaging the mucosa. Here the mucosa is not damaged by laser as is done in the sclerotherapy. So mucosa is not damaged, one important thing. But the most important thing which I would like to stress, that laser fiber should be very cautiously. One should not be hodgepodge in these cases, and proper anesthesia should be given, either spinal, GA, or if one is well versed into the local anesthesia, then can be done under the local block and anesthesia also. So that is important. So if patient will continue paying while doing laser, the laser will not be done properly. Then secondly, shrinking effect of the laser on some mucosal areolar tissue helps to lift the piles downwards, have to lift the piles upwards, which has slipped down. So cushions goes to the original anatomical site. That is, the cushions come back to the original site here. So anatomy is not disturbed. If the anatomy is not disturbed, then physiology is not disturbed. If physiology is not disturbed, patient will not have incontinence or other symptoms of the anal canal. And that is one, we can say, a method which has got these features is an ideal method, along with the economy and rest from the job. The thirdly, fibrosis adjacent to the laser. There is a fibrosis. When there is a laser fiber is there occurs some fibrosis between the muscular layer, and it helps in anchoring the tissues. The shrink tissues will be anchored there. Therefore, after the laser surgery, anatomy of the anal canal is maintained to great extent without disturbing the continence of the anal canal. One of the most common complication of any pile surgery, whether in Ayurveda or whether in the allopathy, it is the incontinence. Incontinence may be minor, may be major, but it is disturbing to the patient. There is a oily soiling of the perianal skin and perianal excoriation are there. So in other words, laser hemorrhoidopexy, or I should say other hemorrhoidopexy done properly, helps to restore the normal anatomy and physiology of the anal canal, and I can say this is one of the ideal method of doing surgery for the piles. So if we say for the laser that almost pain-free procedure, day care, bloodless, no tissue damage other than the hemorrhoidal tissue, any wound caused by the laser tend to heal faster, and ease of the surgeon is there. Of course, it is costlier. Machine itself is costlier, so cost increases. In comparison with the sclerotherapy or foam therapy, cost is very enormous as far as laser is concerned. Surgeon should protect himself by using the goggles. Otherwise, surgeon will damage his eyes because of the laser. This is a very important point in surgeon, and the assisting staff also should protect their eyes. Require general or spinal anesthesia. Some people doing under local nowadays. So all the methods have shown varying degree of success. I should say no method till now in the world is available which gives 100% result and which is ideal method or popular method till date. So we are yet to conquer the recurrences and other post-operative problems, and we are in search of an ideal method, which I already discussed. The ideal method is that which is painless, which does not require hospitalization, which is economic, which does not disturb the work of the patient. These should be taken as ideal methods, and recurrence should not occur. That is another. But I don't think the recurrence will be prevented, because this is totally depend on the habits of the patient. So that is very important. That patient's lifestyle should be tackled along with he should be instructed, consult for the constipation and other causes of the pile production, which causes piles. That is important. Thank you very much for patience listening.
Thank you so much, sir, for your wonderful explanation on the preventive measures as well as recent surgical methods of hemorrhoids. Hope it will be very useful for all the surgeons present here. Since it is time of interactive session, so sir, there are lots of questions collected in our chat box. I have selected few questions. Sir, I request you to please answer the queries. One question is by asking by Dr. Kripal that what are the indications and contraindications of open and closed hemorrhoidectomy?
I should reply.
Sir, is there any indications and contraindications regarding open and closed hemorrhoidectomy?
The open hemorrhoidectomy is always in fourth degree, is always open hemorrhoidectomy is necessary. That is cut excisional hemorrhoidectomy is necessary. That gives the best result. In closed hemorrhoidectomy, there is nothing like closed hemorrhoidectomy. That is we call them hemorrhoidopexy. All these procedures, which laser, sclerotherapy, bending, and applying certain medicines, they are hemorrhoidopexy, and that up to third stage, that is third degree piles, that can be used successfully if done properly.
Okay, thank you, sir. Sir, there is one another question by Dr. Season. What are the management of post-hemorrhoidectomy stenosis?
Of course, anal dilatation, simple anal dilatations, that there are anal dilators of various size are available. Sorry. Anal dilators are available. Patient can himself use them regularly, one by gradually increasing the size of the dilator. Otherwise, if does not respond, then anoplasty is being done by the surgeons. That is the skin from outside, the perineal region is VY plasty, and V shape skin is taken inside. Laser, the stenosis is cut, the stricture part is cut, and that skin is placed in that between, and that will help the very easily the stenosis can be treated.
Okay, sir. Thank you very much, sir, for giving us your important time and giving us knowledge regarding hemorrhoids on this Piles Day. Thank you very much, sir.
Thank you very much. Thank,
Thank you, sir.
thank
Now,
you.
now invite Dr.
Hemanta.
For interactive session. Sir, there is two questions for you which I have selected from chat box, although there are lots of questions. So there is one question asked by Dr. Priya. Is there any chance of recurrence after using Pratisarniya Shar in hemorrhoids? Dr. Ravi Shankar Parwaze, sir.
Thank you. Am I audible?
Yes, sir, you are audible, sir.
Yeah. See, at the area where we do the Ksharakharma, that area there is no chance of recurrence. I have not seen the recurrence till now for last 30 years. But the secondary piles chance is there. Secondary piles, that is a new piles happening. That can happen.
Okay, sir. Sir, there is one more question by Dr. Rohit. In which degree of hemorrhoids we can use Pratisarniya Shar?
So I have already told, instead of seeing the degree, we have to see how the presentation is there. If according to Sushruta, if there is a bleeding piles, and the second thing is if it is Mrudu Prasrita Avagadha, always you go for Ksharakharma. That is what we have to do. The indication what Sushruta told, we follow it, naturally you will get excellent result. But when Tanumula Uchritani Kledavanti, such things is there, then you should go for surgical excision or ligation. And Katina Karkasha Sthira, you should go for Agnikarma. This is a golden standard given by Sushruta. According to that, if we treat, definitely we will get the result. I don't say second degree piles for Kshara, third degree for X, not like that. How they presents you. You examine the patient. If it is Mrudu Prasrita Avagadha, go for Ksharakharma. Tanumula, Uchrita, go for, and Kledavanti, go for Shastrakharma. I hope I have answered the question.
Okay, thank you very much, sir. Thank you very much, sir, for your valuable knowledge to us. Thank you, sir.
Thank you. Thank you very much.
Now, I would like to invite Dr. Narendra Singh, sir, Associate Professor, PG Department of Shalya Tantra, NIA, Jaipur, to give vote of thanks and conclude this webinar. Over to you, sir.
Namaskar to one and all. Today, I think we started this seminar with the objective to extend our solidarity the solidarity, first of all, of team PG Department of Shalya Tantra NIA, and then from each and every person who belongs in one way or another with the fraternity of Shalya Tantra in extended our best support to the persons suffering from this problem, that is basically hemorrhoids. So I think our first objective was to extend our best possible support to the patient suffering from this condition. Now I would like to extend my sincere thanks and heartfelt gratitude to Dr. Ravi Shankar Parvaze sir and Professor N.K. Malpani sir, who remained with us during these two sessions and enlightened all of us with their experience and their own objectives concerning making we people understand about the basic concept of the anatomical or the pathological progress of this condition, and afterward the various sort of treatment modalities which are there concerning managing the hemorrhoids as per the presenting feature. So I, on the behalf of entire team of PG Department of Shalya Tantra, extend my heartfelt gratitude to Dr. Ravi Shankar Parvaze sir and Dr. N.K. Malpani sir, and also hope for the similar sort of support through their deliberation if and when required by PG Department of Shalya Tantra. Now, I would like to extend my heartfelt gratitude to all the delegates who again expressed their belief and faith in the series of the various such sessions which are being conducted by PG Department of Shalya Tantra under the able guidance of Professor P. Hemant Kumar sir and the central administration of National Institute of Ayurveda, now uh, recently who attained the status of a deemed to be university uh, under the revered guidance of Professor Sanjeev Sharma sir. I also extend my sincere thanks to all the delegates who joined uh, with the team NIA in expressing the solidarity in extending a best possible care to the patient suffering from hemorrhoids. At the same time, I would also like to extend my sincere thanks to all the organizing committee and also the from my friends from Himalaya who always extended their warm hand in organizing such events time to time. Now, I extend my sincere thanks to one and all that maybe our authorities from the Ministry of Ayush, our the other superiors who always extended a very warm hand in organizing such events by the PG Department of Shalya Tantra, NIA, Jaipur. So thank you one and all. And at the end, I would like to extend my sincere thanks uh, to my departmental PhD scholars, particularly Dr. Richa, Dr. Rahul, Dr. Rajendra, Dr. Durga Katarmal, my entire residents from the PG department of Shalya Tantra, and my colleagues, Dr. Ashok, Madam Suman Sharma ji, Dr. Swapna Boparathi, Madam Manorma ji, and at last, again, I would like to extend my sincere regards to Professor P. Hemanta sir, that he once again organized a very gala and effective event on the day of World Spoil Day 2020, along with a real support from my friends from the Himalaya Drug Company. So thank you, one and all. Namaskar.
Thank you so much, sir. Thank you so much to Dr. Narendra Singh, sir, to our IT department. Thank you all. Stay home, stay safe. Namaste to all.